Hey guys, welcome to my channel, Not Just a Medico. In this video, I'm gonna tell you about all the important questions of anatomy which were repeated in your previous year question papers. Here I have taken the most frequently asked questions from your previous year question papers. So yes, I can assure you guys that if you study these questions thoroughly, you can easily pass in your exams. And in this video, I'm gonna tell you about one such textbook which has readily formed answers for the important questions. By the end of this video, you'll learn about how to form answers and how to present it in your exams so that you'll get full marks. So without any further delay, let's get into the video. Before starting with the questions, let me tell you guys that there might be few printing mistakes, so I'm gonna dictate all the questions, so do not skip the video. And yes, there might be few repeated questions, so consider it as the most important question. Okay, so let's start with the upper limb first. In this, the important 5 or 10 mark questions are: first one, median nerve in forearm or median nerve in entire upper limb. Second one, axillary artery. Third one, abductor pollicis. Fourth one, first carpometacarpal joint. Fifth one, shoulder joint. Sixth one, thenar and hypothenar muscles. Seventh one, brachial plexus. Eighth one, deltoid. Ninth one, cubital fossa. 10th one, trapezius muscle. 11th one, lumbricals. 12th one, flexor retinaculum of hand. 13th one, supinators of forearm. 14th one, radial artery. 15th one, muscle attachments of radius. 16th one, rotator cuff of shoulder. 17th one, humerus. 18th one, radius. 19th one, ulna. And 20th, superficial palmar arch. In that you have to include about its branches and formation. Next, moving to the 3 marks questions. The first one is, name the nerve of humerus bone. Enumerate the branches of axillary artery. Third one, name the carpal bones. Fourth one, attachments on greater tuberosity of humerus. Fifth one, branches of lateral cord of brachial plexus. Sixth one, lumbricals. Seventh one, parts of upper end of humerus. Eighth one, contents of bicipital groove. Bicipital groove is otherwise called as intertubercular sulcus. Ninth one, name the branches of medial cord of brachial plexus. 10th one, name the ligaments of elbow. 11th one, name the deep flexors of forearm. 12th one, name the contents of cubital fossa. 13th one, boundaries of cubital fossa. 14th one, rotator cuff of shoulder joint. 15th one, wrist drop. 16th one, enumerate the proximal row of carpal bones. 17th one, name 4 structures deep to deltoid muscles. 18th one, name 4 branches of posterior cord of brachial plexus. And the last one is bicipital groove. And let me tell you guys that in this video, I am giving all the important questions, that is, which were repeated in your previous year question papers. So if you want important topics of anatomy, then I have made a separate video on this topic. Do check it out. And this was all about upper limb. The next volume is thorax. In this, the important 5 or 10 mark questions are: the first one, mammary gland. Second one, muscles of respiration. Third one, intervertebral disc. Fourth one, openings of diaphragm. Fifth one, features of typical rib. Sixth one, intercostal muscles. Seventh one, sternal angle. Eighth one, first rib. Ninth one, sternum. And the last one is thoracic duct. This was about the 5 or 10 mark questions. Now let's start with the important 3 marks questions. In this, the first one is parts of parietal pleura. Second one, structures passing through hilum of lungs. Yes, there is a spelling mistake. Third one, name the intercostal muscles. Fourth one, parts of vertebra. Fifth one, origin and termination of thoracic duct. Sixth one, recess of pleura. Seventh one, define bronchopulmonary segments. Eighth one, structure in intercostal groove. Ninth one, clinical importance of pleura. 10th one, parts of intervertebral disc. 11th one, pleura. You have to include about parts and its blood supply. 12th one, vertebral column. 13th one, bronchopulmonary segments. 14th one, left lung. 15th one, right lung. 16th one, medial surface of lung. 17th one, root of lung. 18th one, describe pleura and its recess. And this was the last question. Now let's start the new topic, that is mediastinum. In this, the first one is superior mediastinum. Second one, inferior mediastinum. Third one, mediastinum. These questions can come for 5 or 10 marks. Now let's start with embryology. In this, the important 5 or 10 mark questions are: the first one, spermatogenesis. Second one, oogenesis. Third one, fertilization. Fourth one, fate of corpus luteum. Fifth one, derivatives of ectoderm, endoderm and mesoderm. Sixth one, parts of neural tube. Seventh one, primitive streak. And the last one is gastrulation. Now let's start with the important 3 marks questions. In this, the first one is derivatives of ectoderm. Second one, structure of spermatozoa. Third one, name the parts of neural tube. And finally, we are done with this chapter. Now, let's start with the next topic, that is heart and great vessels. In this, the important 5 or 10 mark questions are: the first one, arch of aorta and its branches. Second one, right atrium. Third one, right ventricle. Fourth one, blood supply of heart. Fifth one, pericardium. Coming to the important 3 marks questions. In this, the first one is branches of arch of aorta. Second one, name 4 branches of descending thoracic aorta. Third one, coronary arteries. Fourth one, name the sinuses of pericardium. Now let's continue with the 5 or 10 mark questions. In this, the sixth one, external features of heart. Seventh one, superior vena cava. Eighth one, inferior vena cava. Ninth one, coronary arteries. 10th one, left atrium and left ventricle. Next, continuing with the 3 marks questions, the fifth one is venous drainage of heart. And this was all about this chapter. Now let's start with the lower limb. In this, the important 5 or 10 mark questions are: the first one, popliteal artery. Second one, femoral artery. Third one, lymphatic drainage of lower limb. Fourth one, great saphenous vein. Fifth one, arches of foot. Sixth one, popliteal fossa. Seventh one, quadriceps femoris. Eighth one, knee joint dorsalis pedis artery. Ninth one, hip joint. 10th one, hamstrings. 11th one, adductor canal. 12th one, ankle joint. 13th one, femoral triangle. 14th one, femoral nerve. 15th one, gluteus maximus. 16th one, structures under gluteus maximus. 17th one, femoral canal. 18th one, longitudinal arches of foot. 19th one, sciatic notch and structures passing through it. 20th, menisci of knee. 21, extensor retinaculum of foot. 22nd, subtalar joint. 23rd, triceps surae. 24th, femoral sheath. 25th, knee joint. 26th, iliotibial tract. 27th, upper end or lower end of femur. 28th, tibia. Now moving on to the 3 marks questions. In this, the first one is name the structures passing through greater sciatic foramen. Second one, iliotibial tract. Third one, foot drop. Fourth one, name the tarsal bones. Fifth one, name the muscles which cause inversion and eversion of foot, at which joint do movements take place. Sixth one, name the attachments of greater tuberosity. Seventh one, name the hamstring muscles. Eighth one, name the branches of tibial nerve in popliteal fossa. Ninth one, name the parts of hip bone. 10th one, femoral artery and its branches. 11th one, name the muscles in the posterior compartment of leg. 12th one, ligaments of knee joint. 13th one, name the muscles supplied by superficial peroneal nerve. 14th one, ligaments of hip joint. Now let's start with the new chapter, that is abdomen. In this, the important 5 or 10 mark questions are: the first one, anterior abdominal muscles. Next, the important 3 marks questions are: in this, the first one is functions of peritoneum. Now coming back to the important 5 or 10 mark questions, the second one is diaphragm. Third one, rectus abdominis. Fourth one, bed of stomach. Fifth one, greater omentum. Sixth one, stomach. In this you have to include about blood supply and lymphatic drainage. Seventh one, external oblique muscle. Eighth one, abdominal aorta. Ninth one, lesser omentum or lesser sag. 10th one, external features of liver. 11th one, relations of liver. 12th one, ligaments of spleen. 13th one, splenic artery and its branches. 14th one, large intestine. 15th one, small intestine. 16th one, features of stomach. 17th one, spleen. 18th one, jejunum and ileum. 19th one, rectus sheath. And the last one is gallbladder. Now let's continue with the important 3 marks questions. The second one, name the components of extrahepatic biliary apparatus. Third one, peritoneum. Fourth one, parts of small intestine. Fifth one, parts of pancreas. Sixth one, parts of gallbladder. Seventh one, name any 2 difference between large and small intestine. And the last one is functions of greater omentum. And finally, we are done with this chapter. Now, let's start with the new volume, that is head and neck. In this, the important 5 or 10 mark questions are: the first one, sternocleidomastoid muscle. Second one, nerve supply of tongue. Third one, digastric triangle. Fourth one, posterior triangle of neck. Fifth one, facial artery. Sixth one, structures passing through foramen ovale. Seventh one, carotid artery. Eighth one, extraocular muscles of eyeball. Ninth one, muscles of mastication. 10th one, internal jugular vein. 11th external jugular vein. 12th one, esophagus. 13th one, buccinator muscle. 14th one, extraocular artery. 15th one, temporomandibular joint. 16th one, carotid triangle. And the last one is constitution of larynx. And the important 3 marks questions of this chapter are: the first one, name the ear bones. Second one, types of tonsil. Third one, enumerate sense organs. Fourth one, name the paranasal air sinus and its location. Fifth one, name 4 muscles of tongue and give their nerve supply. Sixth one, name the bones of middle ear. Seventh one, name the nerve supply of extraocular fossa. Eighth one, name the terminal branches of facial nerve. Ninth one, name 6 structures passing through foramen magnum. 10th one, name the ear ossicles. 11th one, attachments of sternocleidomastoid muscle. 12th one, name the muscles around oral cavity. Third one, name the muscles attached to ramus of mandible. Fourth one, structures passing through jugular foramen. Fifth one, external carotid artery. And yes, this was all about this volume. Now, let's start with the new volume, that is CNS, Central Nervous System. In this, the important 5 or 10 mark questions are: the first one, cross section of spinal cord. Second one, cerebellum. Third one, lateral ventricle. Fourth one, floor of fourth ventricle. Fifth one, parts of corpus callosum. Sixth one, sulci and gyri. Seventh one, superolateral surfaces of cerebral hemisphere. Eighth one, blood supply of brain. Ninth one, blood supply of spinal cord. 10th one, medulla oblongata. 11th one, dural venous sinus. 12th one, cavernous sinus. 13th one, midbrain. 14th one, basal ganglia. 15th one, ventricles of brain. 16th one, middle cerebral artery. 17th one, posterior cerebral artery. 18th one, circle of Willis. 19th one, Structure of neuron. 20th, nuclei of cerebellum. Now coming to the important 3 marks questions. The first one is, name the nuclei present in cerebellum. Second one, draw and label a neuron. Third one, parts of brainstem. Fourth one, parts of caudate nucleus. Fifth one, list cranial nerves in order. Sixth one, circle of Willis. Seventh one, parts of midbrain. Eighth one, name 4 muscles of facial expression and give their nerve supply. Ninth one, parts of corpus callosum. 10th one, name 4 hormones secreted by anterior pituitary gland. 11th one, functions of cerebellum. 12th one, name 4 dural venous sinus. 13th one, internal capsule lesion. 14th one, components of basal ganglia. And finally, we have come to an end of this volume. Now, let's start with the new topic, that is endocrine glands. In this, the important 5 or 10 mark questions are: the first one, suprarenal gland and its hormones. Second one, pituitary gland. Third one, thyroid gland. Now, coming to the important 3 marks questions of this topic. The first one, name the endocrine and exocrine glands. Now, coming to the next topic, that is kidney, urinary system and reproductive system. In this, the important 5 or 10 mark questions are: the first one, urinary bladder. Second one, relations of kidney. Third one, right kidney. Fourth one, left kidney. Fifth one, parts of uterine tube. Sixth one, testes. Seventh one, anatomy of uterus. Eighth one, supports of uterus. Now coming to the important 3 marks questions. The first one, name the contents of spermatid cord. Second one, parts of uterine tube. Third one, layers of scrotum. Fourth one, arteries supplying suprarenal gland. Fifth one, parts of uterus. Sixth one, pelvic diaphragm. Seventh one, ovum. Eighth one, parts of fallopian tube. Now coming to the next topic, cranial nerves. In this, the important 5 or 10 mark questions are: the first one, oculomotor nerve. Second one, name the cranial nerves in order. Third one, facial nerve in detail. Or you can also get the question as, name the cranial nerves in order and describe facial nerve. Now let's start with the smallest book of anatomy, that is general anatomy. In this, the important 5 or 10 mark questions are: first one, classification of joint. Second one, classification of bones. Third one, classification of muscles. And the last one, fascia and its modifications. Coming to the 3 marks questions. The first one, sesamoid bone. Second one, name the cells of bone. Third one, what are fibrous joints? Fourth one, what is myotome? Fifth one, name the 2 difference between artery and vein. And finally guys, we are done with all the important questions of all the 4 volumes of anatomy. Now coming to the most important part of this video is talking about that one textbook which has all the readily formed answers. As you can see here, this is the textbook by Dr. Ladda. You can even buy it online. I will provide the link of this textbook in my description box. You can find it under ₹300. As you can see, I didn't buy this textbook. I had taken Xerox of it because I got to know about this textbook just 5 to 10 days before my anatomy exam. So I didn't want to waste few more days waiting for the textbook to get delivered. And as you can see here, these are the important 2 or 3 mark questions which were frequently asked under the topic head and neck. Then under this same topic, these are important 5 mark questions. Okay, now let's see how the answers are framed. As you can see the question here, write a note on corpus callosum. For this question, we have definition, parts, diagram, functions, and lastly, applied anatomy. Remember that every answer must end with applied anatomy. Next, we have all the nerves of upper limb. As you can see, we have answers for median nerve, axillary nerve, radial nerve, etc. So let's see the answer of radial nerve. It has introduction, origin, course, diagram, branches, and lastly applied anatomy. This is sufficient for 5 mark question. In the same way, we have important nerves of upper limb for 10 or 20 marks. Usually it's for 10 marks for the one who is studying under Rajiv Gandhi University. Okay, next as you can see, we have important joints of upper limb for 10 or 20 marks. And these are the 5 mark questions of upper limb. Now coming to the next part, that is thorax. These are the important 5 mark questions. Now let's look into the answer of this question, that is blood supply of heart. We have introduction, diagram, origin, course, branches, termination, and the answer ends with applied anatomy. And here starts the next part of lower limb. And these are the important 5 mark questions. And here comes the 10 mark questions of lower limb. Let's look into this question of hip joint. And the answer begins with introduction, bones, ligaments, diagram, muscles of hip joint, its blood supply, nerve supply, and lastly the answer ends with applied anatomy. And from here the next part starts. As you can see, these are the long answers of the topic abdomen. And here comes the 2 mark questions of the topic pelvis. And now you can see the long answers of the same topic. And lastly, we have the important questions of the topic histology. So coming to the conclusion, I would definitely recommend you guys to buy this textbook or at least Xerox it, because it is definitely worth every single penny. And finally, we have come to an end of this video. If you find this video helpful, then don't forget to like, share and subscribe to my channel. I'll meet you guys in my next video. Till then, take care and bye bye.